Hi, I'm Mark Robitaille, President and CEO of Martin Memorial Health Systems, and I'm really pleased to be able to share with you some of the experiences that we had in our visits to Virginia Mason and Seattle, Washington, and ThedaCare up in Appleton, Wisconsin. Both trips were very exciting, very exhilarating, and I think our team came back with a lot of excellent information that will certainly help lead and continue us on our journey for performance excellence and the use of lean tools and really advancing our culture. One of the things I'd like to do is certainly thank all of those people who took time out of their very busy schedules to travel to Seattle, to Wisconsin, up and down the state of Florida. Those of you who are watching this video will have the opportunity in the future to participate in our Performance Excellence programs. Hopefully join us as we visit other facilities as we look at advancing any aspect of our organization.
And I took a lot away from it, but I think probably the number one thing I took away from it is that even though we think we do a pretty good job of giving excellent quality of care in an efficient way to patients, there really are ways to do better. And when we really look at what the patient experiences and try to model our system to make that the most efficient and safest experience possible with the patient at the center of it, you can really do some exciting things.
Adopt the best processes available to be able to succeed. I know that where we are now, being a good hospital, we can become a great hospital.
I think going forward in terms of growth for Martin Memorial Health Systems, Lean needs to become integrated in our culture. Corporate business services involves all the areas that have to do with the revenue cycle. And the bottom line is we're going to get paid less, not more in the future. So we have to become more efficient. And I'm now convinced, after seeing it, that Lean will get us where we need to be.
The fundamental purpose here is to improve quality patient care, improved outcomes, and improved patient satisfaction will be borne out in the information we collect from our experience.
I think that there's additional or continued fear about the words performance excellence. We should eliminate that fear. It's not about eliminating jobs, it's about making your job better, to make the patient experience better, to work more smoothly and more calmly, to have a better work environment.
Through the dedication and work of the management team here at Martin Memorial, they're going to provide the tools for us to learn this stuff. And then it's going to be up to us in the actual setting of our offices, in the actual setting of the hospital and the OR, to look at these processes critically and say, hey, look, I think there's room for improvement here. Let's get together and convene one of these rapid process improvement groups so that we can work on this. And yes, there's going to be a fair amount of pain and time lost in the process of doing this in terms of managing this. But if you could see what I've seen on the other end at Virginia Mason University and the productivity that those people had and the stress-free life that was theirs, I really convert that into medical nirvana in my mind.
Process has to happen before design, and I think that's very important as we go forward. I was very excited to see their collaborative care unit and how that team worked together for the best interest of the patient, and I can see how that would be very beneficial to our organization as well.
Another thing that was very exciting about ThedaCare was the patient room that we saw. I guess I would think of it as the patient room of the future, but there we saw it being used right now. I can tell you the nurses lit up. All of us walked out of that room and we just all said the same thing, awesome.
The room was very good size, and it allowed for a lot of room for the nurse to work with the patient. All of the supplies were in the room. They were supplied by the outside of the room, which was very nice. There was a nurse server that pulled out into the hallway. The patient's room also had all of the supplies and equipment needed for the patient, so you never had to leave to go search for equipment. To me, it was a little bit of nurse's heaven.
The other thing I learned, I guess, was to take the time it takes and not try to rush through and not try to jump to solutions again. Work them through with the staff and make sure that everybody on the front lines is engaged in what we're trying to achieve here. And I think that's going to be huge for helping us grow in the future. I think learning to trust the process, seeing that it actually works, and being able to move forward in a leaner environment will be a tremendous growth opportunity for all of us here at Martin Memorial in the future.
I envision an atmosphere where people are encouraged to work collaboratively with others, an environment where we're willing to examine the way we've done things and be willing to change, find better ways of doing things so that we can achieve our goals together.
One of the things that we're finding more and more is that a very concentrated effort of time and people can produce better results and quicker results. So rather than trying to meet for an hour every other week and try to handle a difficult process improvement challenge, having a team wait 3 or 4 weeks, get all the information, get the data together, and then in a very focused environment that may take a day, maybe take 2 days with the proper facilitation, we can really get to a better solution and quicker and implement it quicker with better results.
I think the most important thing is to continually challenge everybody to think, to continue what they can do to improve efficiency, to improve patient care, and cutting down waste. And if we continue challenging everyone at this organization, there's a lot of smart people who have a lot to contribute, and that in the end will do very well.
It is going to take courageous people to champion this cause. The people that want to be champions need to be prepared to be questioned, to have naysayers come to them and point out every failure along the journey. And they should also know that at the end of that journey, when this cause succeeds, everyone will claim to have been a champion. But in order to be a champion at this stage, the critical stage of the journey, it will take courage.